Sure. So the color wheel approach is an approach that just sort of thinks about benign versus malignant. Dermoscopy is a very detailed specialty. And because it's so detailed and literally microscopic, we sort of tend to kind of go into a lot of details before and sometimes almost getting into the weeds about what's benign and what needs to be biopsied and what doesn't need to be biopsied. So when I was tasked with sort of trying to create a textbook with an approach that I take, it's the polar opposite of getting into the weeds. I like to kind of decide, do I need to cut this human being? Or nowadays we have non-invasive imaging, so we don't necessarily need to cut, but do I need to take the extra, step in diagnosing, or is this benign? And later, I'll use the patterns to kind of figure out what version of malignant or perhaps what version of benign, or to reassure me in my decision tree whether it's something that needs to come off or not. And so the color wheel approach kind of takes that into perspective where we just think about not just what we see dermoscopically, but even what we see clinically. So, am I looking at something that's elevated or flat? Am I looking, what color is it clinically? And then am I, looking at what colors dermoscopically? And then if I need to, I'll go into the weeds of patterns, but often I already know just based on those initial questions whether it's something that needs to be left alone or removed. So when we're able to kind of decide whether something is benign or not, we're already 10 steps ahead. And the sort of the precedent, not just in terms of like trying to focus on, do I need to remove this? What's practical? The other precedent for the color wheel approach was early amelanotic melanomas. And so this is a topic that people are often a little bit anxious about, as they should be, because they're difficult to diagnose lesions, even on dermoscopy, even on non-invasive devices like confocal. And so I tried to sort of boil it down to what color is it clinically? Is it pink? Is it pink brown? What color is it dermoscopically? And then into the weeds of the very subtle details. And what this enables us to do is actually catch these lesions very, very early. And given that, certain malignancies like a melanotic will will progress quite rapidly, being able to diagnose things very early, also not having to get into the weeds of deciding, is it an early basal versus an early squame versus, there's certain just really basic patterns as well, or colors that enable us to know this is malignant. Even it's 2 millimeters in diameter, it's malignant. I know it's early malignant. I need to remove it. I'm not going to worry too much about what category of benign or malignant. I'm going to focus on the big picture. Does it need to come off? Is it malignant, no matter how small the lesion?